This is Bill Sive. Homework for course week 2 on the male menopause series. The realities of male biology are at the foundation for men's inherent vulnerability. In this second week of homework, we're going to look at the egg carrier's experience. Pregnancy is a profound biological experience for women, characterized by significant physiological and psychological changes. The following slides are an overview of the biological experience of pregnant women. Pregnancy triggers dramatic hormonal changes in a woman's body. These hormonal changes include HCG, which rises rapidly in early pregnancy, estrogen, and progesterone, which increase throughout pregnancy, affecting various bodily systems. Relaxin loosens ligaments and joints in preparation for childbirth. Cardiovascular adaptations include increased blood volume by up to 50%, increased heart rate, and blood pressure, which may decrease during the second trimester. Metabolic changes include increased energy, changes in glucose, and weight gain. The immune system modulation. The immune system is altered to prevent rejection of the fetus while maintaining protection against pathogens. Some pregnant women often experience mood swings due to hormonal fluctuations, increased emotional sensitivity, anxiety or fear about childbirth and parenting. Some women report changes in memory concentration, sometimes referred to as pregnancy brain, and heightened awareness of potential dangers. There are trimester-specific experiences, such as in the first trimester, morning sickness, fatigue, and breast tenderness. During the second trimester, reduced nausea, increased levels of energy, and fetal movement begins. In the third trimester, increased discomfort such as back pain and swelling, difficulty sleeping, and Braxton Hicks contractions. Biological aging. Recent research suggests that pregnancy may accelerate biological aging. Each pregnancy is associated with about 2 months of accelerated biological aging in young women. This effect was not observed in men, indicating it's specific to the pregnancy experience. To protect of biological effects, some women experience improvements in certain health conditions during pregnancy, such as rheumatoid arthritis and migraines. Pregnancy-associated analgesia has been observed, potentially reducing pain sensitivity in some women, most likely in preparation for childbirth. The biological experiences of women is complex and varies among individuals. While it involves significant physical and emotional challenges, it also encompasses remarkable adaptations that allow women's bodies to support fetal development and to prepare for childbirth. So let's look at the sperm carrier experience. There is no direct male equivalent to female pregnancy in humans. Pregnancy, as we typically understand it, involves the gestation of a fetus in the uterus, which is a reproductive organ that cisgender men and some transgender men do not possess. However, there are some related concepts to consider, and these will be demonstrated in the following slides. Some transgender men and some persons who identify as non-binary who are assigned female at birth can become pregnant if they do not have gender-affirming surgeries to remove a uterus and ovaries. In these cases, the pregnancy process is biologically similar to that of cisgender women, though it may involve different psychological and social experiences. If a transgender man becomes pregnant, you may hear the term seahorse parent. If you're familiar with the biology of seahorses, the male seahorse is the carrier for the seahorse babies. For cisgender men, those assigned male at birth who identify as male, there is no biological equivalent to pregnancy. They lack the necessary reproductive organs, such as a uterus or ovaries, to carry a fetus to term. Science is moving forward in this area. Emerging technologies such as a uterus transplant may potentially allow individuals without a naturally occurring uterus, including cisgender men, to carry a pregnancy in the future. However, this technology is still in its early stages and it has not been successfully implemented in cisgender men. In 2021, Chinese researchers conducted a controversial study attempting to impregnate male rats using parabiosis with female rats and uterus transplants. While this research was raised critical ethical questions, had limited success. It demonstrated ongoing scientific interest in the concept of male pregnancy. While not a biological equivalent, fatherhood is often considered the male counterpart to motherhood in terms of parental roles and responsibilities. The concept of male pregnancy has been explored in various films and television shows, usually as a comic device or as a science fiction concept. In conclusion, there is no direct biological equivalent to female pregnancy for cisgender men. However, ongoing scientific research and the experience of some transgender individuals continue to expand our understanding of reproductive possibilities. Dawn Brooks in the United States in 1997 recorded as the oldest woman to give birth naturally at 59 years old. Nangayama Yaramati from India in 2019 is recorded as the oldest woman to give birth via IVR at 74 years old. These were her first children. She had never had children prior to this. James Smith from the United States in 1948 had twins with his then 38-year-old wife when he was 99 years old. Thank you.